Hello, this is Alana Hernandez with FITGOSSIP. Now you have a face to the podcast. But I just wanted to give you a little video because the podcast that I'm creating now with the surgery that I had a capsulectomy, a total capsulectomy and reconstruction of my chest. And let me tell you, it has been tremendous. The pain has been terrible, terrible, terrible. And I really want to do this part of my video. Like, the first video was just basically saying how difficult it was, like, to lift my arms. But this video that I want to talk to you guys about was because I wanted to let you know what muscles that I really feel just lifting up my arms to hold my phone. If you guys work out, you know about PEC minor, the PEC major, and the serratus anterior, the side. I'm going to try to do a little. The sternum area goes all the way down here. I feel stitches all the way down there. Definitely the PEC major coming all the way up to the clavicles. When I was dealing with the pain before the capsulectomy, before the surgery, the pain in the even like I said in the PEC, the major was like terrible, terrible pressure from the implant because the implant is underneath the muscles. So I just want to give, girls with muscles that work out, maybe, whatever you could use out of this video. But the pain was so severe. And again, my idea was because I had an adjustment, a chiropractic adjustment, because I'm a massage therapist, also a personal trainer, and I use my body tremendously in both, personal training for 30 plus years and competitive. So it's not like I was just working out for overall. It was on a competitive level, which means a very strict, very, besides dieting is easy, now that I'm pro, dieting is easy. But compared to like musculature and the, the body aches and everything, we all go through body aches. So when you work out your pecs, as a female, when I got my implants like 20 plus years ago, working pecs, no big deal. The recovery time, and it's such a big difference from 20s versus 40 plus. 20s, having my implants, it was a weekend surgery, and working out with weights and getting back to the gym. Literally, I was back in the gym. I can remember like that same month, I was back in the gym. I was literally the week after, I would be back in the gym, hitting legs. I wasn't doing too much arms, too much stuff, and slowly worked up, but it was nothing like how now this surgery, as you can see, I'm still not in alignment. I'm still not in the best alignment, and it's because my right side has a kind of an anterior tilt to it, especially when I'm working. Like, it's always contracted because I'm always like using that arm as my power arm, even with massage, because again, this is a brand new career, so massage is kind of like learning the body mechanics all over. And the leg parts, the hip parts, good because you could always bend your knees, and with working out, that's similar. But utilizing the upper body has been extremely difficult because, like I said, just learning how to position my body to work with people's muscles against mine, number one, and just getting all the body mechanics right. It's been kind of a task. So I was getting chiropractic adjustments because let me go back a little bit. So prior to 2018, I've had my implants. They were a little bit hard, but I love the way they look. I never really had an issue with the way they looked, and I really didn't have pain. I didn't have pain at all. I was getting my massages even before this whole situation arose, but the last massage, or the last, I decided after 2018, because 2018 I had been vigorous. I did 3 pro shows. Was it 3 or 4? 3 or 4 pro shows. and my body was beat up because I haven't dieted and I haven't competed years before that. So anybody who's on stage knows that they don't want to look like an idiot on stage, so they're gonna push their asses like crazy. So 2018, I did those shows now, and before that, I was training. So it's not like just one thing after another. It takes about a year to prep. I would say about a year to prep for a show, because really it does. It takes about a year. And then once you do the show, after that point, it might take a year, which for me it was probably like 2 years, to get my body back to kind of normal. And so while this is all happening, I went to, I was working as a massage therapist. And this past year, 2020, 2020 was horrendous with the stress and Corona. So I decided to get some massage, and then I decided to get some chiropractic adjustments, and I got about two or three adjustments, and then the last one, the third one, really, it wasn't a new doctor. It was, I haven't worked with this doctor before. Maybe that's why. I don't know. You could find a million excuses and reason why it happened, because that's what you do when something happens like this, but who knows what the answer is. I'm just giving you what my thought is on things. So that doctor or chiropractor, the adjustment was a little bit, it was pretty intense. So after that adjustment, it wasn't like right after I didn't feel bad. I actually felt good right afterwards, because it really, it does relieve the hips. But, my neck, and I think I have a little scoliosis going on also. But I believe like the upper part, when they kind of, like I said, work again with your serratus anterior, when they kind of like stretch you a little sideways to like get the crack in your spine. That I think was the culprit with this whole situation. So from that point on, it was about a couple of days after that adjustment when all hell broke loose with my chest. And my chest was in severe pain, and it just kept getting worse and worse and worse, and like so bad that I had to stop work. There was no way that I could massage with the pain. Like, the pain was so bad that I had to stop. And let me go ahead and tell you the rest of the story, because it's unreal. No one would believe this story. So I decided to, I knew something was wrong, but I didn't know what it was. And again, everybody was telling me, you're not going to be able to tell. Like, I looked online. You can't tell what's happening unless you get an MRI, right? An MRI, that's the big thing, because nobody has x-ray vision. So I go to my doctor, my primary. He doesn't want to write the MRI. I don't know why. I still don't understand why. They didn't see anything warranting for me to get MRI. So let me fast forward. I get the MRI, and they see some crazy stuff. I had to get all these other tests. And my girlfriend, she said, look, and I thought it was my implants. She was like, see my doctor. So I went to go see her doctor, and he immediately wrote the MRI out, because my doctor, whatever the reason was that he did not see fit to write MRI, that's the only way you're going to see micro tears. That's the only way you're going to see, whatever's happening. And plus, I want to see if my implants ruptured, because I didn't know. The pain was excruciating. So fast forward to my plastic surgeon, he diagnosed me with a level 4 contracted capsular contraction. That's what it is. And so he recommended I get the surgery, capsulectomy, to remove the capsule, totally remove it, and to exchange. And he also did a reconstruction on my chest. So with PECS, with women, the surgeon is super important. I mean, I had a referral from my girlfriend, because she's been with him through other implants and other surgeries. I'm grateful that I chose him, Dr. Takmas, because he is a true surgeon. I mean, I can literally, the pain that I felt, and I know the damage that I had in my chest with all the scar tissue. This is 20 plus years of implants, in addition to 20 plus years of competitive and super duper killing it in the gym with those implants. So, like I said, 2018, I wasn't even done yet. 2018, I would literally hammer strength, incline. I was doing 210, and that was nothing for me because, like I said, when you're competitive and you know what you got to do, and you're pushing weight, that's a lot of weight. You guys know how tiny. I'm not like the biggest bodybuilder in the world, of course not. I'm in figure, and we have a structure. We diet down, and I was pushing that weight probably not just in the beginning of when I started dieting. I was pushing that weight in the middle and at the end, and I should have tailored down a little bit. I'm not saying that was another reason, but I don't know. Like I said, I'm just trying to figure out what the reasons were all this stuff happened. But pain was immense, and then after the surgery, holy crap! I haven't had any kind of surgeries. I don't even like, you know, I would not have gotten this surgery if it wasn't medically and I wasn't in so much pain. Like right now, I'm trying to hold my phone up, and it's pretty difficult right now. I've got to pause this. Okay, so I fixed myself in a better position. So for the surgery, what I wanted to tell you ladies is, or, I don't want to say men too much because I know that there are men that they have surgeries, believe it or not, they do have implants. And the thing that I can give you somewhat the pain, I guess, but I don't know if it's going to be the same because of the hormones and because of the nipple. I don't know. I don't know if men have the same, even if they had the same exact surgery. I don't think they're going to have the same issues because let me go a little bit forward. So I had the surgery in the beginning of the month. Period. You got to think about hormones. Period and hormones. My period isn't due to like the middle of the month. But man, I had my ovulation now comes 2 weeks, 2 weeks before. You know how you are, women, you get it sometimes. But for some reason, I guess because of the de-stress, my period after the surgery, oh my God, so bad because your boobs are swelling up. Sorry, my dog's playing with her toy, so she's making a lot of noise. So the boob swelling up on the inside was so horrible. It was terrible. Like literally horrible. This is now I'm going into the 4th week, a month. And finally, it feels like, and my period's here, like the worst is over. And it's now like finally the swelling is coming down, and I didn't even take off my bra, my surgical bra, because of the swelling and pain. So, I just want to give some of the ladies out there something to expect because I looked at all the websites and everybody's saying, oh, it's so easy, I'm getting back to work. I don't know, maybe it's because of my age. I'm going to be 45. I don't know what it is. Could be the air. I don't know. Like I said, I consider myself not that, crybaby. I mean, fuck, I do figure shows. You're in pain all the time. I'm in pain all the time. When I'm training, I'm in pain all the time. When I'm training, there's not one day that goes by that you're not in pain. So, but compare that pain to this pain, not the same. So fast forward again, this week 4, I'm finally able to use my arms a little bit, even though the pain is still like sharp pains. I tried to wash my hair. I washed my hair today, but there's no way that I can brush it. So it's still going to stay up. I'm still having problems brushing my teeth because the teeth, even pushing that pressure on the side wall of the breast, it's like I said, it's awakening. It should make you appreciate yourself as a woman a lot, because it's amazing how the breast tissues, and not just breast, but your pec muscles on the inside, how they can contribute to all of this going on. It's crazy. So it's a slow recovery, but today it is a better day. I didn't put any makeup on, barely brushed the teeth again, and the hair is not going to be brushed again for another. I'll try again after I can like get the swelling down and chill out, because it is a very mind stressful kind of thing, you know, very stressful. But all in all, I'm positive. I can't wait to get to regular life again, start working out, start massaging, and start training. It'll be wonderful. So thanks a lot for listening to this, and I will update you guys, and I hope you guys are having fun listening to the podcast about everything related to fitness, everything not related to fitness. And thanks for listening to Fit Gossip.